I declare my conflict of interest, but none of the funding bodies influence the research I'm going to present today. And the message that I wanted to say is that our data do really correspond. So basically, I'm going to repeating the messages of Professor Moreno and Professor Velitsa, but just a short snippet from, I'll start with a short snippet about the current situation in Lithuania, PUI research in Lithuania, and 2 adults and children surveys that were done here nationally. And briefly, I'll touch upon the role of impulsivity and compulsivity in the effect of PUI on anxiety and depressive symptoms. So what is the current situation in Lithuania? And probably even better, it's going to be presented today in the afternoon session, because the paper which is shown here is already published. And if you scan this QR code, you can go straight to the policy mapping paper, which tells the situation in Lithuania and compares it with other countries. But what we have important here, as when we look about the policies with relation to problematic use of the internet, we think about the mental health perspective. And only one Lithuania law that regulates and thinks about the mental health perspective is the law on gambling. This law addresses pathological gambling, the obligation to inform gamblers about possible risks, and provides contacts where to seek help in case of need. While it also emphasizes players' protection, the responsibility remains with the individual, who may self-impose limits to the amounts of spending, the size of betting, and gambling time. So we still have a lot to do in terms of good policy in relation to thinking about PUI. And now coming to the research, I would like to acknowledge Cost Action, where it all started in Lithuania, because we started doing research on problematic use of the internet with the start of the Cost Action, which is a successful action which aimed to bring together a multidisciplinary and geographically diverse group of experts and opinion leaders under one European-led network to leverage existing funded research into more coherent program. And out of this program, I can say the Bootstrap was born. So this is the acknowledgements to our start, and what we've done through Cost Action in Lithuania. First of all, to investigate the problem, you need to have a good questionnaire. So I always promote these questionnaires because they are available in these publications, and you can access them and use them freely in your research and clinical practices. They are validated through Cost Action and now free to use. So when we continued dedicated research on PUI, it raised awareness of potential negative effects of internet use that could cause to mental health. And engagement in PUI as an impulsive or compulsive coping with mental distress may also pose a long-lasting threat to the development of anxiety, depressive disorders. And the first aim of our project was to investigate the PUI patterns and mental distress symptoms among university students, and then the general population, including children and adolescents in Lithuania. And the second aim within this data was to test the hypothesis that PUI affects anxiety and depressive symptoms through the mediating role of impulsivity and compulsivity. So to start with the pre-pandemic, we start with a pandemic study in a sample of university students during the pandemic. We see that almost 70% of these students said that their time using the internet changed, either to more using internet or much more. And with regards to their mental health during the pandemic, about 45% said that their mental health were slightly worse or worse. And when we compared both groups, in terms, and the comparison marker was whether the time on the internet increased during the pandemic or was unchanged, we saw that there was a difference in their depression and anxiety level and problematic use of the internet. So those who increased time using the internet during the pandemic had the highest scores on depression, anxiety, and problematic internet use. And within this sample, we also tested the hypothesis that the PUI might lead to depression and anxiety through the mediating role of impulsivity, and this was proved by the study, and these results are written in this study by Gečaitė Stončienė and also available already online. What happened after PUI? So after COVID-19, after pandemic, we wanted to investigate the general population, not only look at the student sample, but more go toward general internet users. And we basically used the same questionnaires, which are problematic internet use questionnaire, PIQ-9, generalized anxiety disorder scales, patient health questionnaire, and we also added impulsiveness scale and compulsivity scale, as well as the mental health well-being index by WHO-5. So in this general population group, what we see that the main device which was used to access internet was mobile phone, and in the group of those at risk of PUI, it was used more often. And now when we look at the data of number of hours that people use internet, so we see that the difference between those without PIU and with those with at risk of PIU is starts at around 3 to 4 hours and then dramatically changes at 5 to 6 hours. So I think this is a time that we have to take into consideration when thinking about PIU. And of course, I have to also say that time is probably not the most important component, but still, clinically, it might be important to investigate the amount of time people spend on the internet. And when we compared those at risk with PIU and without PIU, we also see the higher compulsivity and impulsivity, the lower well-being, and of course, much higher depression and anxiety scores in those at risk with PIU. And when we tested the hypothesis whether problematic internet use might be associated with anxiety and depressive symptoms, now including compulsivity element, we saw that this model was really nicely confirmed, and indeed both impulsivity and compulsivity factors have to be taken into account when we think about possible link between problematic internet use and anxiety and depressive symptoms. And when we look at the children's data, this is the data gathered by Vilnius University by Professor Jusienė, who was unfortunately, due to family emergence, was unable to be here with us today. So I have this great pleasure to present a little bit of data of hers. So she did a study in 3 cohorts, children 6 to 14-year-old, 8 to 10, and 14 to 17 years old. And basically, again, the same questionnaires were used, which is compulsive internet use scale. For children, we had strengths and difficulties questionnaire. And in the adolescent cohort, we also included generalized anxiety scale and internet use time questionnaire. So what is the pre-pandemic data? pre-pandemic data showed approximately 2 to 3 hours of internet use time. And then again, for the adolescent group, the CUS questionnaire differentiates at low risk of PIU, moderate PIU risk, and high PIU risk. So all of the data for children going to be shown in this format. So we see approximately 3 hours pre-pandemic internet use time. And when we go to the post-pandemic or pandemic time, we see the increased number of minutes per day using the internet, and you see how this number changes with the higher risk of being a problematic internet user. And for adolescents, we even see even higher numbers, reaching up to 6 to 7 hours a day using the internet. So this is something really important to look at, especially at the difference between moderate to high PAU levels, as the number for high PAU levels is dramatically different. And when we look at the models, so it seems that for children, we didn't have the compulsivity, impulsivity scales for children and adolescents, but we used the disinhibition scales, which basically shows a lack of controlling your emotions. So for this association, we found that compulsive internet use was again associated with anxiety through the disinhibition, through inability to control and to stop. So problematic internet use affects anxiety levels through the disinhibition, and again, problematic internet use also affected general well-being, which also includes several questions on several items on depression. So problematic internet use affects general well-being also through the mediating role of disinhibition. So when investigating children, disinhibition is one of the components that we have to look at in order to basically not to have this link between problematic internet use and mental well-being, as well as anxiety. So a concerning number of individuals experienced significantly expressed PAU, anxiety, and depression symptoms even after COVID-19 pandemic was over. And findings in the general population suggest that relationship between PIU, anxiety, and depressive symptoms are mediated via impulsivity and compulsivity. In adolescence, disinhibition was found to mediate the relationship between problematic internet use and both anxiety and mental well-being, while significant direct effects remained in each model. So these results suggest that disinhibition plays a partial but meaningful role in linking problematic internet use with mental health outcomes among adolescents. And these results underscore the importance of the inclusion on both impulsivity and compulsivity factors in the studies, analyzing the longitudinal effects of PUI on mental distress. And just to say that impulsivity and compulsivity factors are from the IPACE model, which we use in our bootstrap studies. So hopefully soon we will get an even larger data set to look at this data and to inform fellow researchers and society about the newest mechanisms on problematic internet use. And I'll use this opportunity to thank all my colleagues who worked on these projects, and thank Professor Jusiene for wonderful collaboration together, because we can do a lot of things when we collaborate and connect. And I'll continue on my starting message that through dialogue we can do a lot of great things. Thank you so much.